Good morning, everyone, and namaste. Let me begin by congratulating all of you for putting this program together because the time is just right. And I think the fact of saying South first, despite having Dr. Soin on the stage, is reflective of the fact that so much in healthcare begins in the South. So I couldn't resist that shot, Dr. Soin. But jokes apart and very, very seriously, the promise of the future is super exciting. The fact that we are now at a stage where you can reprogram cells, recreate, a deep understanding. I mean, a decade ago, everybody said that healthcare would be transformed by the 3 Bs, which was biology. We discovered our genetic makeup. By bandwidth, we were able to connect to remote villages, to different areas. And by bytes, which was computing capacity. And with that computing capacity, our CT scans moved from 64 slice to 120 slice to 640 slice, and we began to see more, do more. And then, on the heels of that came artificial intelligence, more computing, more analytics, an understanding of why a certain person got or their gene expression varied. And in the light of all that, with so many of these changes happening, and I think it was very well described, from robotics to artificial intelligence to stem cell to virtual reality. But the point I'm trying to make here is that I wonder how many of us have put a probable age on how long we're going to live. Anyone has some numbers? Is there 100 out here? Definitely. Dr. Soin is 100. Perfect. 70 is too young. Whoever said that, please think some more. So this is a combination of something. A few years ago, I began to do what is called an abundance mindset. And Peter Diamandis' abundance mindset says that the world has an abundance of resources. Nobody needs to starve. It's a different sad fact that people are starving. That we have an abundance of medical capability. Nobody needs to suffer from many of the disease. And the knowledge which is progressing at this tremendous pace is creating a longevity mindset that many of us will live beyond 100. It's a different factor that on the other side, the World Economic Forum is predicting for the world jobless growth. So people are going to live longer, but the number of jobs or the productive work is going to go down. So it's rising or creating a completely different problem. Some super intelligent minds, maybe like Dr. Soin, Dr. Chandru over there, when they realize that their first career is changing, they start moving into their second careers because they use the knowledge they've garnered and keep productive. Many in the traditional form of things are retiring. But more importantly is that youth do not have jobs. So while this conference will focus on longevity, and I'm extremely excited about it, I always believe that conscious members of society, responsible members of society, must understand the juxtapositioning of unemployed youth, of jobless growth, and of longevity. Now jumping very excitingly into longevity and what I always like to term healthy longevity. About a year and a half ago, I had the pleasure of meeting Shimizu Yamazaki. This scientist, this Japanese scientist who is now in San Francisco, discovered what is called the Yamanaka factors. And what this did is that it takes a cell and helps to reprogram that cell into any cell that is required. What we saw in the lab was pluripotent cells were treated with the Yamazaki factor, put in conjunction with other cardiac cells, and started beating like a heart cell. If you look at it as a small test tube or a small actually Petri dish in the lab, it didn't look so exciting. But if you extend your imagination to the fact that if we could inject this into the hearts of 65 and 70-year-olds, and their heart muscle begins to perform like it did when they were 35, imagine what that would do. If you could inject this into damaged, 2 years ago in Hyderabad, we had a young boy who had a racing car accident and damaged his spine. Despite 6 months of physiotherapy, of acute rehabilitation, he is just walking. But he will never be a racer again and never get those reflexes again. Imagine if we could give him one injection and change the course of his nervous system. So the possibilities of what is evolving is tremendous. And this evolution is happening in various stages of science. I'm sure Dr. Soin is thinking, I'm going to be regenerating liver cells, and therefore at some stage he will not need to perform liver transplants. I predict that in 20 years from now, we will not be doing the joint replacements that everybody is doing routinely, because we would have treated it much earlier. Whether we're doing stem cell injections to regenerate cartilage, we're using AI to do gait analysis and therefore gait correction and prevent or reduce the extent of wear and tear on the joints and change the way we live. In addition, there are multiple factors. It's not just the knowledge and the awareness. There's an entire aspect of controlling the environment. The microplastics, which have become a part of our body now, and Chandru and I were talking about this a little earlier, will be modified. The detection of microplastics, the treatment of microplastic will be put bacteriophages into our systems. Therefore, they're eating up the microplastic before they become part of our body. There's a transformational way of looking at things, and we are on the cusp of that across the universe and definitely across our world. And so I'm extremely excited. When I heard the topic and Dr. Soin called me and I heard that, you're talking about this, I was very, very excited because I also believe that this is India's time. There's some reasons which lead me to believe that. It's not just the fact. Some of you who saw today's Economic Times, the big four again have all Indian leaders on top of them. McKinsey has just selected an Indian, a native Indian, as the head of McKinsey Global. So what I'm referring to is the brain power. We have the capability to think, to analyze, to work hard, to research. And yet our researchers are doing fantastically in NASA and global positions. How much more can we enhance what's happening in India? Now, interestingly, on the health side, we have the data. If you take the Ayushman Bharat data and start analyzing this, we at Apollo have approximately 14 million records and about 9,000 genotype-phenotype analytics. We're doing multiple AI algorithms. We created a cardiovascular risk score in partnership with Microsoft. We did an early detection system for TB, which we're actually donating to government hospitals in conjunction with Google. But all these are just scratching the surface of the possibility of what is the future of healthcare. And so programs like these and interactions like these, I hope, will accelerate the pace of investment into research and a new age in healthcare, will accelerate the number of people, of young people, who are coming into science and research. Because if you've done medicine, very few are choosing research as a methodology to use their medical knowledge. And the extent of time that a practicing clinician is giving on research is also very low. There are few exceptions, but not many. So I believe that conferences like these, an awareness of the pace of change and the possibility of what the future holds for us, will accelerate this movement into integrative medicine, into research in longevity, into new technologies, whether it's CRISPR or a different way, or research in stem cell, will enable us with our data and our knowledge and our skill sets, will enable India to change the positioning that we've had in healthcare. For many years, we at Apollo took great pride in saying we started in 1983 and we telescoped the developments of the Western world. What happened over 30, 40 years, we brought it in 10 years into India. But today we have another dream, we have a different vision. We want to be the ones setting the agenda. We want to be the ones creating the new cures. We want people from across the world to come to India because this is where it is happening. And right now, let me be very honest, I visited Buck Institute, I've seen what's happening at Stanford, I saw what's happening at Mass General and Mayo. we are very far away. We need to do a lot more. And so again, I congratulate the organizers for beginning to raise the topic of longevity, of science and research, of allied technologies to apply into a better life. I can't end just talking about all these high-tech things because there's a lot of basic things that remain to be done. So I will actually conclude by sharing one of the things we're doing in a village called Aragonda, which is in Chittoor. We began this program about 20 years ago, actually 24 years ago, where we started a small hospital. The villagers there told my father, "You've put up all these things, what have you done for your birthplace?" So he put a 100-bed hospital over there, and doctors from Chennai and Hyderabad would go. It was a beginning. In the year 2000, when Bill Clinton visited Hyderabad, he pressed a button connecting telemedicine, using telemedicine to connect Aragonda to Hyderabad and to Chennai. We then created a rural insurance so that the villagers had access to that. We then said we may be thinking of tertiary care, but what is needed greatly in Indian villages, and this was 24 years ago, but it still remains the same, is a focus on the social determinants of health. So we created clean drinking water supply, which is now run by the youth of those clusters of villages, nutrition, preventive healthcare screening, whether it's mammogram, cervical cancer, cataract surgery. So a series of proactive health initiatives. So why I'm concluding with this is, while we are aspiring to do AI and stem cell and regenerative medicine, in the same breath, we need to ensure that our knowledge that we currently have, this topic that we are speaking about over the days about the acceleration from bench to bedside, or to keeping people out of the bedside, keeping them healthy and active. But what we also need to do is to ensure that clean water, sanitation, nutrition, and preventive, proactive health screening programs tackle what is the tsunami of non-communicable disease and ensure that we are finding these early. Because every time a cardiac surgeon does a bypass on 3 vessels and a cardiologist does stenting for 5 vessels, the question somewhere in the mind is, where was this patient when his first vessel was getting blocked? 65% of the cancers we detect in India are in stage 3 and stage 4. We need to ask ourselves, why didn't we find them in stage 1, and why didn't we prevent this cancer? And therefore, I conclude by saying that it's a unique time in the development of science of the world. It's a unique time in the opportunity that we as healthcare professionals or people passionate about a better healthcare need to focus on the basics, need to enhance our infrastructure, need to continue to look at preventive healthcare and preventive medicine and regenerative and the future of medicine, focusing on not just longevity, but healthy longevity, not just healthy longevity, but healthy and happy longevity. All the best to all of you. Good luck and namaste.